Hello, and thank you for joining today. During this webinar, we're going to share Buckeye Health Plan's new patient-centered service plan signature requirement and the steps providers need to take to provide necessary signatures. Today's goals are twofold. First, you'll understand why Buckeye is implementing this new signature requirement. Secondly, you will learn how to sign service plans through Buckeye's Secure Provider Portal. Let's start with the why. Why is Buckeye implementing this new signature requirement? As a managed care plan in the state of Ohio, we are required to adhere to the CMS guidelines and regulations. To be compliant with this requirement, a patient-centered service plan must be finalized and agreed to with the informed consent of the member in writing. This includes acknowledgement by all providers responsible for implementing the service plan. By signing this service plan, the provider acknowledges and agrees to provide the listed waiver services to our members. This signature is required when any new service is authorized for members or when an existing service plan has been adjusted or edited for any reason. The only providers that need to sign this service plan are the providers who were affected by a change in the service plan. The preferred method of signing service plans is through our Buckeye Secure Provider Portal, which I will walk you through shortly. The requirements for obtaining provider signatures vary based on the type of provider. There are two types: direct care providers and indirect care providers. Direct care providers have face-to-face interaction with our members. This includes personal care providers, waiver nurses, home care attendants, and others who work directly with our members. Direct care providers must sign the service plan through our portal. Indirect care providers help our members but don't necessarily have face-to-face interactions with them. This includes home modification specialists, mobile meal providers, and all providers who are not listed under the direct care provider list. For this group, Buckeye captures their signature by using their signature from their contract. There is no need for indirect care providers to sign waiver service plans through our portal. This requirement rolled out on January 1st, 2019. Now, we are requiring all participating in-network direct providers and out-of-network direct and indirect providers to provide signatures. Again, the Buckeye Provider Portal is the preferred choice for capturing direct provider signatures. Again, we want to reinforce that this is a new state-mandated signature requirement. As a managed care plan, we must comply. It is important to know that these signatures must be obtained within 30 calendar days after the services have been started. Here is the link to our secure portal, provider.buckeyehealthplan.com, to add your signature. Now, we'll talk about Buckeye's Provider Portal. If you're not already familiar with the portal, it's very simple and easy to access. Just go to provider.buckeyehealthplan.com and register for the portal. If you are part of a larger practice, we recommend your practice account manager create the first portal account. He or she can then review and grant access to all other providers in your practice. Other team members, such as those who handle billing and claims, can also register for accounts. There are many things that you can do in our provider portal. You can check member eligibility as well as submit and manage claims, submit, edit, and review authorizations, as well as review the payment history of your claims. You can view the member's gaps in care, which are our HEDIS measures. You can also send a secure message to Buckeye through the portal if you have any questions. If your practice has a larger billing team, you can also manage multiple accounts. Next, I'll walk you through the step-by-step process on how to find the patient-centered service plan through our portal and then how to add your signature. This slide shows you what the portal's home screen looks like. You will log in with your username and password. From there, you'll click on Patients on the top ribbon. A list of patients will not populate for you. You need to find these patients. To do so, click on the orange Find Patient button. A new window will pop up and you will type in the member's date of birth and either their last name or their member ID. Click Find. Next, the member's information will pop up. On the left-hand side of slide 12, the screen capture in the back shows you a menu on the left with Overview, Cost Sharing, Assessments, and a couple more options. Click on Assessments. From there, the information will repopulate and look like the screen capture in the front box. You'll scroll down until you see the Patient-Centered Service Plan, PCSP, Signature Addendum. Right next to that is the blue box that says Fill Out Now. You'll click there. Just like you see on this slide, there is a list of options. Make sure you scroll down until you see the Waiver Service Provider link. And remember, there will be other types of providers that will need to sign this form too. On the next slide, you can see the screen capture showing you where you'll fill out your provider information. At the top, it asks you, are there waiver service provider signatures to collect? Choose Yes, and then these other boxes you're seeing here will populate. You will input the service type, your name, and the member's name. Even though you are in the member's file, you still need to re-input the member's name here. Enter when the service plan was created, and acknowledge that you have reviewed it and you understand that you're part of the service plan. Then sign and date. If you are unsure what the service type is, here is a list that you can select from. Now, let's go back to the previous slide. Once you've inputted the information we just reviewed, scroll down to the bottom of the page to click Submit. Once you click Submit, a new window will pop up confirming that your signature has been received and will be reflected in the member's service plan within 24 to 48 hours. So again, here are the service types we just referenced. If you have any questions, concerns, or if you want to give us feedback on this process, you can follow the link listed here on the last slide. Or you can call Buckeye Provider Services at 866-296-8731. Thank you for your time, and I hope this webinar has been helpful.